Hi, so my name is Natalie Lung, and I am going to be presenting my project on the identification and management of immunization administration errors. So first of all, I'd like to acknowledge that when I was doing this project, I was on the land of the Squamish, Musqueam, and Tsleil-Waututh Nations, which is now known as Vancouver, but today I'm presenting on the lands of the Songhees and Esquimalt Nations. Okay. All right, so for my program, or for my project, I was working with the BC Centre of Disease Control. I was under the supervision of Dr. Monica Naus, who is the Director of the Immunization Programs and Vaccine Preventable Diseases Services. Also, I was under the supervision of Stephanie Meyer, who is the Director of Professional Practice. Sorry, she just got promoted, so I was mixing up the positions there. But yeah, so my project, which is on immunization administration errors, was a project that was started in about 2019. Dr. Naus was really concerned about the issues that would occur in immunization administration. They started on this project, but as we all know, in COVID-19, there was a little bit of a pandemic that happened, which took priority. So this project had to be put on the back burner. And as I started my practicum and I got to choose which project I'd like to jump on, immunization administration errors sounded really interesting, a really under-researched project at the time. So yeah, I decided to take on that, and under the direction of my supervisors, this is the research that I found, and I get the opportunity to present it to you guys today. So just with a brief overview of the importance of immunizations. So vaccines are an essential component of public health, contributing to the prevention and control of infectious diseases. The World Health Organization describes the pivotal role that vaccines play, citing the prevention of over 20 life-threatening diseases, ultimately averting an estimated 3.5 to 5 million deaths annually. Their efficiency, both in terms of efficacy and cost effectiveness, has been proven to help reduce disease transmission and allow people to live longer and healthier lives. So even though the efficacy of vaccines relies on the development and the distribution of the vaccine, it also relies on the correct administration of those vaccines. Errors in vaccine administration can lead to multifaceted consequences, which emphasizes the need to evaluate the administration methods. So immunization errors can lead to reduced effectiveness of vaccines, which compromises the immunity against targeted diseases. And such errors can also lead to or erode public trust in vaccination programs and healthcare providers, undermining confidence in vaccine safety and efficacy. So the goal of this literature review was to systematically gather and synthesize available data and research pertaining to immunization errors encountered during vaccine administration. So because there is a small scope of existing research on immunization administration errors, these questions were generated as a guide for our search. So along with identifying the underlying causes of such errors, the review aimed to identify literature that presents methodologies for the prevention and management of these errors. So since the immunization errors encompass many types of error occurrences, the literature also the review focused specifically on preventable errors in immunization administration. So as such, these errors were aimed to be examined for their root causes and to understand how they can be prevented. So our methodology just included a systematic search of electronic databases, specifically PubMed and Elsevier. A variety of keywords were used in the search, and our exclusion criteria just included articles regarding inborn errors of immunity. And we use this framework to help us identify the different types of errors. So this is the 7 rights framework of medication administration. And it states that the right product should be delivered to the right patient at the right dose, the right time, the right route, for the right reason, and the right documentation. So in the context of this review, the 7 rights framework was utilized to analyze and categorize immunization administration errors. And by applying these principles, patterns of errors could be identified and assessed where deviations occurred in the immunization process. All right, so going through the results, or the general findings of the literature, it was found that immunization errors were not common occurrences. However, of the errors that occurred, they were found to occur the most in routine doses. Immunization errors occurred in every age group, with the highest prevalence among children under the age of 2, which is likely due to the very complex schedule that is recommended within that age group. So following the framework that was used, we start going to specific error categories. We have the occurrence of wrong vaccine errors, which arises when an incorrect vaccine is administered to a patient. There are several reasons this would happen, but one is namely due to the similarity in names among various vaccines. Now, this can be attributed to either the different combination of vaccine agents within a single vaccine, or the use of identical or closely resembling abbreviations. Notably, vaccines within the tetanus and diphtheria containing vaccines are particularly susceptible to this. For example, in those vaccines, you have DTaP, DT, TD. It gets quite confusing there. Next, we have instances of wrong patient errors. This was less likely to occur in the literature. However, this would occur very often due to sibling confusion. When you have multiple siblings within the same vaccine appointment showing up, and the vaccine administrator may get confused of which vaccine each sibling needs. You have your wrong dose errors. The literature does reveal a multitude of factors contributing to this. One involves the improper administration of vaccine volumes, and this can arise from inaccuracies in the concentration of vaccine solution being administered. Another source is the confusion between multi-dose and single-dose vials. So this highlights some confusion due to vaccine packaging. So as we can see here, we have two vaccines, both for influenza. One of them is a single dose and one of them is a multi-dose. And if you did not know what a single dose looked like, you would very easily administer a multi-dose to, or too much of a multi-dose to one patient, and that would result in that error. So the next type of error is wrong time errors, and this is strongly linked to the inappropriate scheduling of immunizations. So vaccines, there are many vaccines that require multiple doses and adhere to strict schedules between the doses to provide adequate protection. And a critical root cause for this type of issue is inadequate immunization records. Many patients show up to immunization appointments without a complete medical history, which results in inadvertent premature immunizations. Next, we have wrong route errors, and this is a significant concern in vaccine administration, so occurring when a vaccine is intended for a specific route but is mistakenly administered via a different route. You have three types of mistakes that can happen in this way. When you have a vaccine designed for an intramuscular administration being delivered subcutaneously or vice versa, and you also have instances where orally administered vaccines are mistakenly injected. Lastly, we have expired vaccines, and this is pretty self-explanatory, but when an expired vaccine gets administered, and this is typically due to incorrect storage methods or short shelf lives of certain vaccines. So from the analysis of these results, as there were many, we developed suggestions that can mitigate errors at a systemic level. The methods that we looked at tried to focus on many errors at once, but these were most of the strategies that we came up with. So we have improved vaccine packaging. Factors such as small text on labels or overlapping color schemes have been cited as contributing to error occurrences, and this just requires a reassessment of design aspects like the formatting of vaccine names to ensure optimal visibility and readability. We have the integration of EMRs, or electronic medical records. When patients show up to appointments without their complete medical records, that leads to a higher likelihood of vaccine errors or administration errors. And having electronic medical records that are accessible by vaccine or immunization providers across, sorry, just gonna start back from the beginning there. But by implementing EMRs that can be seamlessly accessed across different healthcare providers, the likelihood of administering extra doses or missing doses during appointments can be reduced. We have patient checks and identification, just ensuring that we have the correct patient before administering the vaccine. The next we have is distinct patient appointments. This one is aiming to ensure that we don't give the wrong vaccine to the wrong patients when siblings are involved. Comprehensive education and training for immunization providers. And lastly, we have barcode technology. Now, this was a very specific strategy that that my supervisor was really interested in, so we really delved into that. All right, so barcode technology. The integration of barcode technology into vaccine administration protocols holds a lot of promise for mitigating many preventable errors. Just due to time, I'm not going to go into this too much, but it's just quite surprising that this is not something that is totally integrated into barcode technology at a provincial level yet. There are some barriers into implementing this. However, we did, for example, we have vaccine providers not being willing to at least accept barcode technology, thinking that their methods are more efficient. But we did find that facilitating conversations and listening to complaints from the vaccine administrators and finding methods to improve the barcode technology within those clinics was a good way to help with resistance to change. So with everything that I've done in this project, the future implications, although there are a lot there, all in all, it's just that improving vaccine administration practices does require collaboration between many different factors or many different aspects of public health. But hopefully the research that I did in my program or my project here will help with mitigating immunization administration errors in the future. Thanks for listening.